Hey Cam followers, this is another audio with the lovely Dr. Katie Friel-Russell. She's a fantastic vet stroke behaviourist who's given up her time for free to answer some of the challenging questions that the Cam followers often pose to us. So hopefully this set of 5 audios is going to be helpful, so please do listen to them. These are things that we as vets, therapists, behaviourists see on a regular basis. So you might not think it's applicable to you, but please listen because you might just find it is. And this is a key topic that might just prove that point to you. So today we're going to talk about appeasing behaviours and how often the public really misunderstand what they're communicating. So take it away, Katie.
Okay, so these behaviours are the ones that are most often misread by people, because this is when dogs want to gather or give information. So they're worried about a social interaction that could be with a person or with a dog or sometimes with other animals. And what they want to do is to find out if that interaction is going to go well or if they need to be more worried. And the way they do it is they want to get really close to the person. They want to try and sniff them. They want to lean up against them or jump up at them and sniff and lick their faces and ears in particular. And that's all about getting information, because if they did that with another dog, it would be really successful. Dogs are giving off loads of pheromones, lots of information that we can't understand, but other dogs can. They can read the other dog's emotional state. So they can say, oh, he seems nice and relaxed, so now I can relax. When they do it with people, it's obviously not very successful because we can't read each other's pheromones. But when dogs do it to us, we completely misread it as them being really happy and excited.
Yeah, or disobedient.
Yeah, oh, yeah, absolutely. Yeah, lots of people will get really frustrated with them jumping up, but they might get frustrated when they jump up strangers. But then when they walk home and the dog does it to them, they might really like it, which is a whole nother kettle of fish.
Oh my God, that's just a whole mixed bag, isn't it? Can you imagine how confused that poor dog is, where they're allowed to do it then, but not then, and actually just never know when is okay.
Oh yeah, absolutely. And so this is that they're trying to get all this information, but then they also give information in 2 ways, which again we completely misread. So the first one is they might urinate, and this happens a lot with lots of puppies. People will say, oh, I walked in and puppy did a wee on the floor, and people get really frustrated because the puppy, maybe they weed on your brand new shoe, and so then they'll often shout at the puppy. The puppy was already worried and you've just made it more worried. So actually tomorrow it's more likely to wee even more and even quicker for you, which then frustrates people. But we don't think of it as being anxiety. A lot of people will think they were just excited that they weed, and that's a term all the time, you know, an excitement wee. But if your dog's got normal bladder control, they shouldn't be weeing because they're excited. That's not something we see. And when we look at their body language, we can see that they're actually quite worried in those interactions.
Yeah. I see this, I do see it a lot as a first opinion vet, in that you'll have the dog that kind of comes into the room and they're almost over voluntary. The owner quite often interprets it as the dog loves coming to the vets, and they come into the room and they're all over the vet. And you can't help but feel that you're liked, you're loved, they're happy to see you. But now that I know more than I did before, I realise that they're coming in and they're trying to assess the situation as quickly as possible, aren't they?
Absolutely. People say, oh, you know what? My dog loves the vets. They drag me in from the other side of the street. They're desperate to get in there. And actually that makes no logical sense. You know, I think vets are lovely people. I'm going to say that because I'm one. But we do things to help dogs, absolutely, and it's vital, the work that we do. But it's not very nice for dogs, and that's, you know, I've always worked trying to reduce all the stress possible, but nobody gets that excited to go to their GP or to the dentist. You know, you shouldn't be thinking, I'm desperate. It's that desperation to get in there, as well as their body language, that gives it away that it isn't excitement, because that wouldn't be.
And it is quite funny, because when you say it like that, you know, in the horror movies, they say never go in the basement, never go in the basement, like the room that has no exit point bar the stairs. And that's the same for most consult rooms, isn't it? You know, the dog runs into a room with no exits.
Yeah, and because this appeasement behaviour isn't something that humans really do. You know, it's not one of our emotional responses. We very rarely would think about getting information in order to feel more confident. So it's much harder for us to comprehend it. But dogs do it readily all the time. And yeah, absolutely, going to the vets is one of the biggest times we see it.
Yeah.
One of the other behaviours that they do for appeasement behaviour is rolling over, which again is so misinterpreted, because when the dogs roll over during an interaction with somebody, and then people think, oh, he wants his belly tickled. And how many times does that happen at the vets? And when we look at the dog's body language and that exact same behaviour in another context, so if two dogs greeted each other and one rolled over, we would never say that that dog wanted its belly tickled. You know, that's not what they're doing there. They're giving information. They're actually showing off their bits because they're all smelly and they're full of pheromones, and they're saying, I really want to be your friend and I don't want this to become scary. And so
I love that. That's such a good thing, isn't it? You know, we could do that. Take a picture of a dog on its belly, you know, its belly exposed at the vets, and then just cut the image out and put the dog in a different situation, and how us as owners have made that mistake. We do, don't we? So
absolutely, yeah. And people say at the vet, you know, oh, the only person he lets tickle his tummy is the vet. Why would a dog do that? The vet's the scariest person they need.
Such a good example. I love that. I see a lot of appeasement behaviours in Luna, actually. Even though she's been hugely socialised from like I got her at 7 weeks, and she's come on all of our lectures, all of our owner workshops. She comes to the hairdressers, the train station, the bus. We go everywhere together. I can still see that she's actually deep inside quite a nervy little girl, because she does appeasement all the time, and she has to get as close to you as possible, and she does that with everybody that arrives, and collecting info, isn't she?
Yeah, absolutely. And it's so rewarding for us as people. We get so many endorphins when we touch animals, and we love that they're showing how we would show love.
Yeah.
Don't think about what their emotion actually is.
No. So the reason we're doing this audio is to just highlight to people that this does exist. And again, I'm sure that there's going to be many people listening going, they don't know what they're talking about. That's absolute rubbish. How? No. I think behaviour, as with science, is progressing dramatically quickly. And I know in my career as a vet, I've seen a lot of changes in understanding in behaviour. And I think this is much more well established, isn't it? That, you know, this is one of their behavioural responses, and it isn't to be interpreted how humans would like to interpret it. We've got to see the bigger picture. And,
Go on.
Oh, and I just wanted people to understand that just because they're coming up and greeting you and, you know, all over you, doesn't necessarily mean they're not in pain. That's one of the reasons that we're doing this audio.
Yeah, absolutely. Because a lot of the dogs, when they're, especially the low level, when they're starting out with pain, they're going to get more appeasing, and they're going to do it more because they're more sore. And so if you're more stressed because you're sore, your behaviour starts to get a little bit worse, but it'll be a bit mild. So a lot of people will see these changes but think they're a good thing, whereas actually it should start making you think, maybe I need to go to the vets, because they're doing this and they don't normally do that. And it can be a signal of early pain.
And that's a really good point to kind of end this little series on, is that it's definitely about behavioural change. And it's a bit of an old construct to always link repulsive behaviours with pain. There's definitely a tendency for people to believe that an animal, no matter what it is, in pain, would only ever express it by showing its teeth, growling, getting the hackles up, that sort of thing. I think people can get their head around the avoidance behaviours as well. I think there's a connection there, that people can understand if something hurts, a dog would be trying to move away from the thing that could potentially hurt it. But with appeasement, like we've just talked about, I think that's a real challenge for a lot of owners to understand. Why is it important? If we can identify the signs of pain earlier, we will be able to get on top of it quicker and more successfully. And we'll also be able to influence the dog's quality of life for longer. And we honestly know that if we can manage chronic pain better, we get years, a lot longer with these dogs, because we don't get all the secondaries that come with it. So if we're treating pain appropriately, we're not going to get the secondary physical manifestations, and we're not going to get the secondary behavioural manifestations, which, let's be honest, we do all hear of stories of people that have had to let go of their dogs because a behaviour has got too bad. And we have, sorry?
Yeah, it's the number one reason that animals are giving up, and pain is such a big cause of those behavioural problems.
Yeah, it's so heartbreaking, because that dog at that time needs Rona the most. That time, can you imagine? You have got a condition where you are in a fair amount of discomfort continuously with intermittent spikes, and the person that you have faith in has gone, nah, you're unpredictable. Break my heart. Oh, Lena, put this away. Right, so we're going to end it here. Thank you so much, Katie. It's been amazing, like utterly amazing. And I'd really like to invite you to come back as much as possible. Whenever you've got something that you want to talk about, let's do an audio. Let's put it out here so that more and more people can get a better understanding, so that we can help more and more dogs.
Yeah, that's great. Thanks so much for having me. It's been great.
Perfect. Take care, camp followers.